My name is Tara Jackson, and I serve as president of the Arizona Town Hall. Briefly, we are a nonprofit who has been around since 1962, serving a mission of educating, engaging, connecting, and perhaps most importantly, empowering Arizonans to address the most difficult issues facing our state. If we had known 2 years ago all that 2020 would bring, we could not have picked a more relevant topic than creating vibrant communities. The fortuitous selection of this topic, which will be addressed this year and into 2021, has allowed us and our partners to be of immense service to stakeholders and leaders across Arizona. We've already conducted numerous virtual community town halls on this topic, and we will be conducting many more through 2021. During a community town hall, participants discuss what their community needs most to thrive and creates a plan of action to accomplish their goals. If you are a part of a community or a group who would like to host a community town hall, simply contact me or Amanda Nelson. I believe the contact information is in the chat room, and also you can respond to the registration that you had for this program. Today's program is really about setting the stage, learning key facts and ideas from some of the brilliant minds who contributed to the background report on this topic. Facilitating this panel of experts is one of the people who not only inspired the selection of this topic, but who also served as one of the lead editors for the background report. At this time, please give a warm Zoom welcome to Jon Ford, the Director of Strategic Initiatives for Vitalyst. Thanks, Jon.
Thank you, Tara, and thank you everybody for being here today. We were so glad to have you today. I think there's many thank yous to give out. As Tara mentioned, Amanda Nelson. Amanda has been instrumental in putting together this webinar. Obviously, thanks to our panelists, and we will meet them in just a moment. But also thanks to 2020, I guess, for turning this into a Zoom meeting instead of an actual in-person meeting. We hope to be together again as soon as it is safe and appropriate to do so. Until then, we are so glad to have you here today. As Tara said, we could not have come up with a better topic for 2020 and 2021 as creating vibrant communities. And we were very fortunate in the process of putting together a background report for that topic to come into contact with some extraordinary people, some of whom you're about to meet. In fact, if you would, I would like to ask our panelists to go ahead and turn their cameras on. Good afternoon to you. Let's see. What happened here? Oh, there we go. We got everybody. All right. Math is not my strong suit. All right. We've got a lot to cover today, but just so you all know, there is a background report document that is the basis of our conversation today. And what we have are 5 people who contributed to that background report. The background report itself had multiple topics and multiple authors, but these are the folks that we really felt were just fantastic people to be the ones to introduce the background report to you today. Now, we have a very aggressive time frame in which to talk about some very complex subjects. So I want to make sure that you know who you're seeing and ask them to introduce themselves quickly. Amongst the many topics of the report, these 5 people have chosen very specific topics to write about and talk about. And we're going to start today by introducing you each individually. We're going to start with Joan Timeche. Joan, please introduce yourself. Talk about your chapter very briefly.
Lolma, my name is Joan Timeche. I'm a citizen of the Hopi Tribe, and I serve as the Executive Director of the Native Nations Institute at the University of Arizona. Myself and our research director, Miriam Jorgensen, and Holly Figueroa all joined together to talk and provide all of the participants a brief overview about Native nations and how vital we are to the state of Arizona.
Thank you, Joan. Ladies and gentlemen, I just need to call this one out in particular. This is a tremendous contribution to this background report. It's just one of those all meat, no filler kind of chapters. Not to disparage anybody else on this meeting, but when the chapter was turned in, we looked at it and we went, wow, that's really long. Maybe we should cut it down. And then we realized there is no cutting it down. It is an essential chapter for all Arizonans to read, and we hope that you will do so. And Joan will take us through some of the key facts for that today. Next, I want to move on to Kelly Eckhoff. Kelly, please introduce yourself. Talk about the chapter that you contributed to.
Hi all, I'm Kelly Eckhoff. I'm the co-founder of Kominote Community Consulting, and we work with nonprofits around the state. The chapter that we wrote and I'll be talking on today is Adverse Childhood Experiences.
And that topic of adverse childhood experiences has been one that Town Hall has worked with in the past. We felt it was important during this Vibrant Communities 2-year period to spend time digging deeper into that, and Kelly will share more with us about that today. Adrienne Udarbe, could you please introduce yourself and your contribution to your chapter?
Hi, everybody. My name is Adrienne Udarbe. I'm the Executive Director of Pinnacle Prevention, and I contributed to the chapter on food systems.
See, you say that so succinctly every time, as if food systems aren't as complex as they are, but we are going to dig more into that as we talk today. Next up, Stephanie Parra from All in Education. Stephanie, could you please introduce yourself and the chapter that you worked on?
Sure. Thank you for having me. Stephanie Parra, the Executive Director of All in Education. Grateful to be here. We are a new education advocacy organization in Arizona, focused on ensuring that the individuals from the communities that are most impacted by the inequities in our education system have a seat at the decision-making table. And so we focused our work around access to high-quality education.
Excellent, thank you. Another small, simplistic topic, right? We'll dig into that more in just a minute. Last but not least, certainly not least, Dr. Bob England. Hello. Bob, could you please introduce yourself, since I can't seem to get your name right, could you please introduce yourself and the chapter you contributed to?
Yeah, hi, I'm Bob England. I'm a public health doc, recently supposedly retired. I retired in 2018 after running the Maricopa County Department of Public Health for 12 years, and then got called back to be the interim director for Pima County until leaving last June, right at the peak or close to the peak of the first wave of COVID that we've been dealing with. Our chapter was about how all of the great public health successes of the past have been policy systems and environmental change based, mostly governmental, and about the factors that go into that drive, that human behavior is really driven by the environment around us.
If only your topic was more timely. Gosh,
Yeah.
Oh well. Great, thank you all for introducing yourselves. Joan, I want to turn to you first. As I had mentioned earlier, a tremendous compilation chapter that your team wrote. Take us through why people should be reading this chapter, which attempts to summarize 7% of Arizona's population, 27% of its land mass, and practically, and frankly speaking, more than 10% of the background report.
Okay, it's going to be really difficult for me to try and condense it, but I think the point that I would like to bring across to the participants that are on the call today, on the webinar today, are that Arizona, what we know is Arizona today has long been home to indigenous peoples, and it's been well documented. Today we have 22 federally recognized tribes that share geography with the state of Arizona, and our jurisdictions often overlap. These are, I call them 22 nations within the United States, and there are 574 across, and Arizona has the 3rd largest Native American population. We're involved in all aspects of just the entire state. So when you think about it, in terms of the state of Arizona, it could not be vibrant as a state without making sure that those 22 tribes are also experiencing that same vibrancy. If we're gonna, if this is gonna work, each of us has to be able to share that responsibility. You know, I view it as, or we view it as a responsibility of this Arizona state government, all of the subsidiaries, the counties, you know, the cities, the Arizona-based businesses and nonprofits to be able to work with Arizona and the non-Indigenous residents too, in partnership with tribal governments, our tribal businesses, our nonprofits, and our citizens, you know, so that we both join together to make sure that this happens. I could go on a number of other topics that deal with some of our challenges, but I think that I did want to say that if you read the chapter, you'll hopefully get a good sense of what exists today, hopefully overcome some of the stereotypes that you may have learned or assumed, and as you were thinking about Native Americans. And I wanted to say that, you know, the challenges that we face are wide. You know, we have huge, you know, we lag behind in education. Housing, both on and off reservation, is really a big issue. We have a very large indigenous population within the state of Arizona. And when it comes to healthcare, we have huge issues there. You know, think about any of the social problems there we have those issues, and it's all about recognizing tribes as government and moving forward there. And I don't know if we want to get into the COVID impact, but maybe I could just mention two big challenges that we have out in or maybe three big challenges as it relates to COVID. One is that because of our unique funding mechanism for tribal governments, we don't have a tax base like cities, counties, and state does. So we have to generate our own revenues to be able to provide governmental services. Because of that, our funding for essential governmental operations such as becomes scarce, because those that had casinos had to close down, or in any of the hospitality enterprises, they closed down as well. So all of us are really short on funding. Clean water, particularly in some of the remote reservations, like my reservation, the Navajo reservation, where you won't find homes with all of the modern utilities, is a big issue. And then broadband is another, broadband and telecommunications equipment being available to our students from K through 12 is a big issue, because they can't even, I know folks like in my own village of Udarbe, which is by choice, has made a decision not to have any of the modern utilities. They have to depend on generators, gasoline generators, or either solar systems. And sometimes you have multiple children who are in school and they're fighting for the 1 or 2 hours to charge a laptop, only to not have access to the broadband. Anyway, I could go on, but I will stop there and allow for other participants to speak, panelists to speak.
Thank you, Joan, for kicking us off. Really appreciate it. In fact, in the tribal chapter, Joan, you specifically call out adverse childhood experiences, which brings us to Kelly. In the tribal chapter, you talk about how the rate of adverse childhood experiences in Arizona is highest amongst tribal communities. Kelly, talk to folks who are not familiar with ACEs about what ACEs are and why they matter.
ACEs are defined as stressful experiences, events, or effects experienced by children ages 0 to 17. And they matter because there are long-term implications of ACEs that build with more adverse childhood experiences a child has. Some of the long-term implications are physical health implications like higher rates of heart disease and cancer, and higher rates of mental health challenges like substance misuse, depression, and suicide. In sum, ACEs impair a child's ability to cope, function, focus, build healthy relationships, and make positive life choices. So, and as you mentioned, I mean, not looking at it specifically at the tribal communities, John, but across Arizona as a whole, we have the highest rate of children ages 0 to 17 that have experienced 2 or more ACEs. Nationally, that rate is 20.5%, and here in Arizona, as of last year, it was 27.3%. So I think that it speaks to the importance of looking at ACEs and how to not only prevent them, but address them once they've occurred.
Perfect, thank you. We're going to keep following this thread because Stephanie, when it comes to children and when it comes to ACEs and when it comes to education, there's a lot to say. Let's talk a little bit about ACEs. Let's talk a lot about education. Let's talk a lot about inequities as well.
Yeah, absolutely. So, you know, the underlying kind of commonality amongst groups having access to high quality education, we know as educators that poverty is the greatest barrier to educational attainment. And so what we've seen across communities, and certainly our effort when we launched our outreach effort after schools closed last spring in response to COVID, we targeted the Latino community, but knowing that, you know, Native students, African-American students were likely also experiencing a lot of the same challenges because of the ACEs, because of living conditions and experiences that they have in their home life. And so what we know, what we found when we reached out to parents and families in the spring, this was back in April and May, parents were struggling with communication with their schools, just a simple breakdown in communication of not being able to, you know, get sufficient guidance in how they can support their child's distance learning at home. Joan referenced it already, but obviously technology was a major gap. And we knew going into these conversations with families and educators that the digital divide was not new to us. We knew that these inequities existed before the pandemic hit. What COVID did is it shined a light on everything that we have been talking about for decades, that low-income families and communities of color are disproportionately impacted by the inequities in our system. And so the technology gap presented itself in multiple ways. It wasn't just about a lack of access to devices or a lack of access to broadband. Certainly that was a major component, but it was also a technical skill set gap of not knowing how to navigate the tools. And then parents not having a how-to guide or a help desk or someone to call for guidance. You know, by the time I spoke to some families in May, I was the first person on the phone having a conversation with them in their native language since mid-March. So they had no communication for 2 months. And so you can imagine the level of frustration and overwhelm that I received on the other end of the phone. And so when we think about educational attainment going forward, we have to ensure that we're closing these gaps and opportunity for kids and families, because a simple breakdown in communication can mean that a child has been offline for the last several months since schools closed. And so, you know, as educators, we have a responsibility to our communities, to be connected to them, to engage them, to involve parents. And one thing that I say often is that what we have right now is a real opportunity moving forward to change how the system functions, to truly transform how we operate so that we include community and that we value our diverse community as an asset, not a deficit, not a problem that needs to be solved, but truly an asset that deserves investment, so that all boats are lifted, so that all communities rise. And that's the work that we'll continue to do at All in Education.
And by change, I think what you're really talking about is something systemic and transformative, because we know what this system produces.
Absolutely. Yeah. I mean, we need systems-wide changes. We have to think beyond, just closing a small gap here and there. Like, there are major gaps in the system. In the report, I talk about we've been talking about gaps in attainment between communities of color, and in particular, the Latino student achievement gap has been highlighted since I was a senior in high school almost 20 years ago. The first report came out, and we've been talking and talking and talking and talking, and it's time to stop talking. Simply, let's have a conversation that moves us toward action, and let's focus on what we can do to truly invest in communities and take action to support the communities that are impacted by these inequities, and really look at the system as where are the gaps, what communities, where are the communities that we need to invest in, and instead of painting a broad brush like everyone starts from the same place. We don't. We have to accept the fact that we don't start from the same place, and we have to ensure that how we invest in our education system, it gives every child the opportunity to have a level playing field, because we're not all coming from the same place for the reasons that Joan referenced and the reasons that Kelly referenced. We all have very different backgrounds and experiences.
Beautifully said. Thank you. Also, I'm just going to say it, the ASU stuff in the background and then kind of the U of A clothing. It's quite the balance you're striking. Nicely done.
All the way, through and through.
Adrienne, we're going to keep following this thread too about kids and about schools and about ACEs and about COVID. Folks thought for sure when COVID hit that that the first systems to break down would be housing, education, and yet there was another one that really broke down like super fast, and that was your food systems. Mm-hmm. Talk to us a little bit about that, and talk to us about some of the key points in the chapter.
Yeah, so when I'm talking about food systems, we're thinking about it from all of the supply chain elements. So from land access, water access, agricultural production, moving down the line to distribution, consumers and purchasing behaviors, and then also those other external environmental elements, which are things like labor and justice, and just culture and values around food, which also then, of course, feed into the most important aspect, which is policy. And so amid COVID, what we've seen is there have been folks that have been experiencing food insecurity long before COVID and living in this place of scarcity. But when COVID hit, I think all of us, if you've never been in that place where you have experienced that, we have all experienced some form of scarcity amid COVID, especially around food, whether it's just empty supermarket shelves or not finding your favorite food items or whatever that might be. But that was further magnified among those that have been living with food insecurity and in poverty since COVID. And so what COVID brought out and really started to shine a light on was disruptions in supply chain. But to that point, there's also some benefits that have come to this of just increased demand and folks looking inward at our local Arizona food shed as well too. So increased supply and demand amongst local foods with our local farmers who have been incredibly innovative in how they've been diversifying their business operations to implement online purchasing mechanisms and drive-through options and different aspects of making sure that food still gets to the people. And I think the most important point is to recognize that food is a basic human right, and access to good quality, healthy food is a core value that leads to vibrant communities. So we need to be able to move beyond just othering folks and seeing it as individual choices, but recognizing that if it's a basic human right, we need to have an environment, a policy, and a system that back that up fully and completely.
Adrienne, for years past, people had talked about if food trucks stopped rolling into Arizona from other places, we would have about how much food, how many days worth of food actually locally?
So locally, we do actually have enough. It depends on which county. So within Maricopa County, let's say, which is one of our largest counties, at this point in time, we have enough to feed, for a year plus. It's not that the food isn't there. The food is there. But the problem is where the food is going out to right now. And then, of course, it's rapidly disappearing as well, too, because that agricultural land is rapidly being displaced by development and other factors as well, too. So currently the food is there, but it wouldn't supply us for eternity. And I think we need to start thinking about when the next pandemic hits, is our local food shed in a place to be resilient and responsive?
Bob, you're sort of sitting in the cleanup spot again. That's intentional because of the work that you have done over your career with the counties. I'm saying counties plural now. Touches on all these aspects, and you do so within this governmental sphere. Joan brought up the fact that obviously it gets even more complicated when we're talking about tribal nations working with the dominant governance structure as well. Talk about some of those challenges, but also how through your experience, you've seen some opportunities that just weren't realized.
Yeah. Let me break it down to human behavior, okay? Because whether you're talking working with entities, these are all human creations. In our society, there's a lot of politics that drives a lot of those relationships. And even when you're talking about individual behaviors, it gets way more complicated than we'd expect. I mean, I began my career naively thinking that if I just educated people well enough and explained issues well enough, that we'd just all make the right decisions, and people would behave in a way that would improve their health, and we'd all get along just fine between different entities, and elected officials would naturally want to do the right thing, and it would all work out great. It was all just a matter of understanding. And human behavior is just way more complicated than that. All of the great achievements that we've ever seen in improving health, and probably in other aspects of society as well, have all been about making environmental changes around people so that their behavior is what it needs to be without people even thinking about it. If education and working together could achieve what we needed, we wouldn't have a tobacco problem, right? But if you put in the Arizona Smoke-Free Air Act, we saw a 20% overnight decrease in smoking because it was just less convenient. You get about the same decrease in college campuses if you go to a campus-wide tobacco-free policy. You get an overnight 20% decrease because you can create an environment where people behave a certain way just because it's easier. And that rolls over to what we're currently dealing with COVID as well. There's a recent article out which clearly demonstrates, they looked at all the counties in Kansas, and the counties that had mask mandates have lower rates of COVID transmission and infection than the counties that rely on just recommending it and relying on human behavior. It's unfortunate. It's just the way it is. And if I can use an analogy of that, in terms of preserving freedom while still creating policies that help us all, I'll use driving as an example. You know, we're all free to get in our cars and drive on any public road and go wherever we want, but we don't get to drive there just as fast as we damn well please. The reason we can have orderly movement around our society in traffic is because we have rules of the road. So similarly, when we're facing crises like this one, if we can keep businesses open and we can keep schools open if we abide by the rules of the road with all the masking and social distancing and so forth. And enforcement won't be perfect. It's not perfect for driving either. We all experience that every single day. But having those rules of the road in place that we're all expected to abide by will make it possible for us to get through the period we're living through now.
So Bob,
yeah, go ahead.
Well, not really, but that's okay. It takes us down an interesting path. For the folks who are here listening to this dialogue and thinking about the very real issues, very much like the COVID-19 pandemic right now, there is frustration amongst people that on both sides. There's frustration that I don't get my personal liberty, and then there's frustration that the state government won't put in a statewide mask mandate. So where's the path forward where we work together to create vibrant communities? How do you see that needle getting threaded between the different sides of the story?
You know, as was mentioned before, earlier, the disparities that we've seen in the impact of COVID on different racial ethnic populations has shown a light on the underlying disparities in health status that we have tolerated for so many decades. And I really think that, you know, when it was first being reported that there were wide disparities in outcomes between different racial ethnic groups in this country due to COVID, the only thing that surprised me was that anybody was surprised. I mean, we've known about these underlying disparities, these horrible, in many cases, underlying disparities for decades and decades and decades. And if it shines a light on that, and it shines a light on the fact that, hey, you know, some of the most physically demanding, lowest paid jobs in our society are now, that are disproportionately held by people of color often, are suddenly our essential workforce. And those folks were expected to continue to put themselves at risk, often because of their lower wages. They're riding a bus to get to those places in the first place. And we couldn't even provide them adequate PPE along the way to help protect them. So I think recovering from this episode with a greater understanding amongst the public of those disparities in the first place gives us a real opportunity to rebuild with equity more in the forefront. As Stephanie mentioned, we got to actually do it, not just talk about it. But I think it really does. We're in a position now coming back where I think people, I hope, the body politic has a greater respect for what a lot of people do to make us all able to function.
Well, and in fact, some things that we've been talking about for a long time suddenly became okay to do. Adrienne, there has long been a discussion about how to create more access to healthy, affordable foods for all people, not the least of which was the proposal to use SNAP benefits and to say that those benefits could be doubled if they were spent on local, fresh, and healthy foods. That was a debate for a long, long time. And then all of a sudden during COVID, what happened? And What do you have to say about that?
Yeah, so amid COVID, some of the good that we've seen come out have been all of a sudden these regulatory exemptions of, oh, we need to streamline this and we need to make it easier for folks and we need to maximize, nutrition assistant benefit value. Like all of a sudden there's a recognition of maybe we should stop making people jump through so many hoops to get access to good food. And those are things that shouldn't be one-time exemptions. They need to stay. So things that I'm talking about are increasing the SNAP benefit allotment. We know it's supplemental, but even despite that, many of you maybe have taken the SNAP challenge, just trying to live off of what the allocation is. And it's nearly impossible to feed a family. But other things that came to be was recognizing that schools are a primary source of food for so many kiddos. And when schools were closed, there was an inability for those kiddos to get access to food for a short time. So then PEBT, pandemic EBT, came out to help subsidize and create and give more foods to folks. So all of that maximized that value and that dollar. And then what we ended up seeing in the incentive program that you mentioned, which is Double Up Food Bucks, which every SNAP dollar that's spent, we match it with an additional dollar for Arizona grown fruits and veggies, is that a huge increase in purchasing and consumption of local fruits and veggies. So to Dr. Bob's point, it's not that they didn't know that they shouldn't be eating fruits and veggies. Everybody knows you should be eating fruits and veggies. When they had the financial ability to do it and those barriers removed, that's exactly what they did.
Joan, COVID-19 sent a flood of attention to tribes, particularly the Navajo tribe. Has that been good? And what good has come out of it?
As has been said earlier, we've been living with these challenges for many, many years. And I also want to say that we have huge diversity across the state of Arizona in our tribes. Some are, didn't experience what we saw at Navajo or in White Mountain Apache as an example. But I did, I think it was a plus in that we're finally getting heard. There's finally attention. There's finally resources. We've long been wanting to partner with other entities, and because of our history and the colonial impact that it's had on us and on our governmental forms and so on, there's sometimes has not been always a great relationship between the tribes and the state and the counties and the cities. Racial tensions are a big, huge issue that have already existed for many, many years. And so I think this pandemic just brought us back down to the core of who we are as humans and people, and our own reminding us about what our own core values are, that we help each other. And that to be able to get through this, we have to overlook some of those things, and we have to join together. Everybody has a role to play. Everybody has to contribute and so on. And so I think that with all of this, it helped to do that, but there are specific kinds of things that can be done. Like as an example, just even with access to funding, there needs to be better systems put in place at either state, and largely at the federal level for tribes to be able to access some of the funds that cities are able to obtain. It's been a huge fight for us to be able to find the monetary resources to be able to begin addressing some of these issues. And as you've seen, some of the nations, with what little they had, they stepped up to the plate. They came in and they set up their own rules because things were not happening outside within the state or at the national level. And we are going to protect our people, and some of us are very small in number. And if one family gets sick, it can have a devastating impact on an entire nation, tribal nation. And so for us, I think that many of our people were just willing to be able to move that forward. But there's still a lot of work that needs to be done. It's even stuff like, learning about each other's governments, a simple step, what does a tribal government consist of? What are its powers and authorities? Maybe even abandoning our presumptions about each other, who we are as people and what's true and what's not, and then valuing and upholding the tribal sovereignty of tribes, that we can be partners. And in some cases, some of our tribes have funding And I have other resources that can help contribute to help solve these greater problems that we all have, that we're all experiencing today. And
So
some
we can't,
answers too.
yeah. So we can't see our audience, but I think their virtual heads are nodding based on the comments that are coming through in the chat box. Stephanie, your head is nodding for sure.
Yeah.
Is it possible to say that you could be optimistic about what 2020 has done to us and what it might lead to in the future? And if so, what is that path forward? We got a specific question in the chat box about, okay, we all agree that these things have been exposed, and now the tough part is doing something about them. Do you think that we have that opportunity now?
I absolutely believe that we have an opportunity, and we have a moment, like I said, that, you know, we've been talking about these challenges, those of us that have been advocating, you know, to rid the system of the inequities for decades. We know what we've been up against, and John, you and I have talked, like, the system has been working the way it was designed to work, where communities of color are held back. That is the system that this country established for us. And it's on us as leaders to intentionally go back and create opportunity and advance justice for all communities. Otherwise, if we don't use the moment that we're in right now to reflect and to really start peeling back the layers of the system that we have established for us, we'll continue to spin our wheels, and we'll be having the same conversation 20 years from now. And the impact that has on our economy is reckless. It will be reckless for us, because the demographic shifts are already here. I serve on the school board of Phoenix Union High School District. Our demographics are 90% students of color. Over 80% of our student population is on free and reduced price lunch, meaning that they are low income, low socioeconomic status. Our demographics are 10 years ahead of the city of Phoenix and 20 years ahead of the state of Arizona. So if in 20 years, 80% of Arizona is poor, what does that say for our economy as a state? It's not good. Any business leader will know that that's not good for a state's economy. And so we have to rally around this moment to say, we cannot allow communities, the fastest growing demographic population, to fall behind, because the Latino community, Native community, African American community have been disproportionately impacted by COVID, infected at higher rates. And we cannot allow these communities to fall behind. We have to ensure the success that they not only survive COVID, but that we thrive beyond COVID. And there are action steps that we can take. One of the things that we have launched at All in Education is a new pilot program called the Parent Educator Academy. In response to all of this, we created a Parent Educator Academy where we're going into 5 targeted school systems. We're partnering with 5 school systems in Phoenix and in Yuma. And intentionally, you know, where there are high concentrations of communities of color, low-income families, to create an opportunity, not just to make sure that parents know how to support their kids in distance learning, but that they have the tools and resources to do so, that they have a potential access to an economic pathway, a career, if they so choose. How do we create future paraprofessionals and education professionals out of our parents? Because we're asking them to be educators at home right now. So can we upskill them? Can we train them? Can we include them in a more meaningful way in our education system? And when we talk about our goals that we have set as a state, where we want 60% attainment, the 60% attainment goal that Achieve 60 has set out for us, it won't happen simply with the student population that we have. We have to look at adult learners in our community, and we have to look at how we upskill adult learners and get them certified and get them professionally trained in living wage careers where they have access to benefits and healthcare. So we have things that we can do, but we have to get creative.
Thank you. Guys, Stephanie just kicked it off without me even knowing. And I'm shocked to see that we only have like 10 minutes left. So what Stephanie just did, I want each of you to do as well. Think about what opportunity has arisen, what has been exposed during COVID, and somebody in the chat box called it a COVID keeper. Give us your COVID keeper, the thing that has arisen from COVID that you think could make an instrumental difference in changing policy systems and environments. And I'm going to kick it next to Kelly. What's your COVID keeper?
I think as far as ACEs are concerned, one of the COVID keepers would be looking closely at the availability of affordable housing in our communities. Homelessness is a common adverse childhood experience, and one that has just incredible long-term negative outcomes. And so I think with this mandatory pause on evictions has helped. And I think through COVID, because people experiencing homelessness are at higher risk of not just contracting, but also dying from COVID-19, I've seen a lot of governments and nonprofits really looking at the affordable housing inventory in their communities. And so I think that's going to have a really positive, profound impact on reducing adverse childhood experiences in Arizona.
Excellent, thank you. And thank you for choosing such a small change that needs to happen. Bob, I'm not going to leave you for last this time. Bob, what is your COVID keeper?
Oh man, I'm hoping that it's an increased awareness of how all of this is interrelated. Vitalyst has always done an excellent job of pointing out all the social determinants of health and how they all essentially get back to social equity and what drives things. We have all, but it's often tilting at windmills to get people to understand how that all interrelates. And it goes the other way too, how health impacts people's ability to learn and their future incomes and their future prosperity and so forth. It's all a web. And I think the keeper from this is that people are just all going to get that now. It's going to be much easier to explain so that when we make all manner of policy decisions, it's going to be obvious to people how health interacts with education and economics and social justice and income opportunity and the physical environment around people. It's just going to make it all easier as we come out of this.
Yeah, and vice versa.
Yeah.
Adrienne, what's your COVID keeper?
So my COVID keeper would be to maintain the demand and the passion for our local foods and supporting our local farmers of where we're currently at. But I think to be able to do that, we need to put policies in place that are addressing the land access issues and the water access issues. So if we want to maintain access to our local food shed, then we got to make sure that our new and beginning farmers have access to land and access to water.
Joan, is it possible to do a COVID keeper for 22 tribes in less than a minute? I don't think so, but I'll give you.
I think, it is a really difficult one, but I would think about is just the recognition of that we do have these 22 sovereign tribes, and that we have been resilient. We have challenges, but we are resilient people, and that hopefully there is going to be an openness, a greater openness to working with each other at helping to solve common problems. There's
Great,
a whole lot more involved in that, but
I know. This is crazy how fast this has gone by. One more question for each of you. Think about your chapter and your contribution to the chapter and the fact that we want people to dig into those chapters. So something you haven't talked about yet that's in your chapter that'll get people to dig in to the topic. I'm going to start with Stephanie.
Yeah, I would just add that, I think for us, representation matters, and making sure, to Joan's point, that our community, the Latino community perspective, our lived experience is honored, valued, and respected at decision-making tables. Because when policy makers are making decisions on our behalf without our perspective in the room, there are unintended consequences that have happened over and over and over again in past years. And so ensuring that that representation is in the room, from classrooms to boardrooms at the local and state level.
May I also add, not just perspective, but wisdom. Wisdom that's left out if those folks are not at the table.
Absolutely.
Adrienne, one key thing from your chapter we haven't talked about yet.
Yeah, I saw a lot of comments in the chat box about taking action. So let's talk more action, to echo Stephanie's sentiments. And if you want to find out ways that you can take action related to food systems efforts and what has been done, especially on a policy level, then I encourage you to read the chapter to learn a little bit more about what has happened in Arizona and what could happen.
Perfect. Thank you. Kelly?
Yeah, I think I would be remiss to talk about adverse childhood experiences without bringing up some promising strategies for addressing them. And the one that we talk about in the chapter, and the one that I feel really strongly needs to be implemented in our criminal justice systems, our school systems, and youth-serving organizations, is trauma-informed care. So I would encourage anyone working with youth or in any of those systems to look into trauma-informed care. And there's lots of trainings available here in Arizona through the Arizona Trauma Institute and Arizona ACEs Consortium to get adults trained in trauma-informed care, because the research has repeatedly shown that it really just takes one positive adult in a child's life to make all the difference.
Perfect. Thank you. Bob, over to you.
The way to improve health is not to focus on health. It's to focus on social justice and equity in all these other areas that we've been talking about.
A+ for concision. Thank you, Bob. Joan, same question to you.
I think I would just encourage them to read that little section about the value of collaboration and some of the suggestions that we made there.
And I'm just going to put the extra emphasis on wisdom coming out of tribal nations that has long been ignored. So definitely read that chapter, folks. We have just a minute or so before we need to bring Tara back onto the stage, such as this virtual stage is. I want to thank you guys very, very much. I know this was super short for everybody, but I think you guys were fantastic. The work you did that you put into the background report was over the top amazing. I encourage everybody to read the background report. I know it's not short, but it is worth your time. Thank you, Adrienne. Thank you, Joan. Thank you, Bob. Thank you, Stephanie. Thank you, Kelly. We will continue this conversation without question. We have all the way through 2021 to explore the topic of vibrant communities. I'm sure we'll be hearing from you all again soon, and we look forward to that dialogue. And at this point, I'm going to turn it back over to Tara. Tara?
Well, Jon, and to this incredible panel of speakers, thank you so much for sharing your wisdom today. It really gave an insight into not only the information, but the powerful tools and recommendations that are part of the background report. So again, I would encourage anyone to use that as a reference. There was also a lot of talk today about key elements that are really part of the Arizona Town Hall process if you're not familiar with what we do. One is that we truly believe in the value of diversity, not just creating diversity for diversity's sake, but the value of having diverse voices and perspectives at the table, that it brings a wisdom and allows every community to come together in a way that creates the best solution moving forward. To that point, at all of our community town halls and even our statewide town hall, a critical aspect that we have is how each person can feel empowered to take action. There was a lot of discussion today, rightly so, about policy changes. And policy changes almost always need to be made on these issues. One of the ways, though, that we can also create change that everyone can be a part of, whether they are a 14-year-old or someone who has to stay at home, is to allow them to create action, whether it is simply sharing information, reaching out to help a neighbor, realizing the point that so many of you have brought up, that we have to move forward as a community if we want to move through what 2020 has brought. And the last thing that I really want to add that all of you highlighted is that this is an opportunity. Yes, there have been tremendous challenges this year, but what is that quote? Don't let a good crisis go to waste. What a lot of opportunities this year brings, and that so many of you I know are already a part of, and we look forward to continuing to be a part of, both working with all of you and the work that you've put into the background report with our partners Vitalyst and so many others who are helping us do this. And for all of those listening in, feel free to join us in this effort, whether it is in small ways or big ways, promoting a community town hall discussion in your community, or simply sharing some of the information you've learned today so that we can continue to move forward with this wisdom and find a way to be resilient and even move above and beyond the challenges that 2020 has brought. So John, thanks again to you and to Amanda, who is running everything behind the scenes. And I hope that all of you stay safe and that we will see you soon.
Thank you all.